right, welcome everyone to another session of the Sim Media Center here at INACSL 22, International Nursing Association for Clinical Simulation and Learning. We're at our annual conference, the first one back in person after 2 years here in Milwaukee. So excited to have some of the leading champions in the space joining us, including my next two guests here. We have Carol Durham, who is the Director of Simulation at UNC Chapel Hill, and we have Mary Ann, who is a consultant at NLN and as well the president of GNSH. And so GNSH is the global network for simulation in healthcare. It's kind of a think tank group that helps to bring leadership from not only INACSL, but all the nonprofit organizations that are out there, CESAM and IPSS and Simulation Australia and ASPE, all together, ASPE UK, ASPE in the United States for standardized patients, to think about the industry from kind of the widest perspective possible. I know also we have commercial partners that are joining and participating, Laerdal and many of the other groups in the space that are really excited about coming together annually and taking a look at the industry and trying to think tank to new innovative ways and best practices. So you've both been helping and supporting that organization. I know I've had an opportunity to go to a couple of those events, but tell me a little bit more about what is GNSH and what is it trying to accomplish as a whole, and then we'll go into what's been going on with it recently.
Yeah, GNSH got started in 2010, I think it was. Carol. Yes. Carol's been involved longer than I have, actually. And it's kind of unique in that it brings together the leadership of many different organizations around the world that believe in simulation and believe that it can be a solution to some of our problems in healthcare.
Sure.
But also the vendor community is so important because they need to know what products we need. And they see the universe of simulation differently from academics and from those in practice settings. And so collectively, I think it's a wonderful way for us to get together, talk about problems that exist in healthcare and what we can do in simulation to attack some of those problems and work together. And I think the one thing about GNSH is that we can't do it by ourselves. It requires a collaboration, and every organization has its own strengths,
right,
and unique characteristics that can contribute various pieces. And when we all come together,
right,
it's wonderful.
It's not only about the networking and learning that takes place for the leadership of all these industry, institutions or organizations and corporations, but also about pinpointing where are the opportunities to collaborate in a way that promotes the industry as a whole, right? And I think that's what's so great about GNSH is it provides like the first kind of opportunity for us to really do that, in an ongoing capacity, because INACSL has its own marketing efforts. HealthySimulation.com has its own marketing efforts, right? SSH and all the rest. And so we might be missing, some of the community might be missing about some of these resources. They might not know about them, or more importantly than that, I think some of the messaging that takes place is different, right, between these organizations. Mm-hmm. And so I think bringing groups together and having kind of one look and one team, kind of in essence, it provides for a way to better communicate about simulation to the wider global audience as a whole. I think everyone who's attending here at INACSL has drank the Kool-Aid, in my opinion, right? They're invested, right. They're excited about it. They're willing to show up to either participate if they're new to this, or they're already been a part of INACSL for many, many years. And so for me, I think groups like GNSH are going to start to help us expand the conversation beyond those that are already, bought in, that are interested. And so would you talk to us a little bit about what is GNSH accomplishing right now? What are some of these unique projects that GNSH has been working on? And talk to us a little bit more about that, Carol.
I wanted to tack on to what you just said, because
Sure.
I think it's really a great point, is that everybody is doing some really amazing work, but there is so much work out there that needs to be accomplished that we cannot, as Mary Ann said, do it alone.
Right.
And so this group brings together a uniquely different group of societies and industry together to kind of look at these big problems. But the point is, we all have the same goal,
yes,
which is improving patient outcomes,
right,
improving patient care.
Mm-hmm.
And when you look at why are we doing the work we're doing, then this makes it possible for us to come together and collaborate.
Right.
And that's really powerful.
Right.
So we have done some amazing work at looking at what are the issues around the world that are healthcare issues that we have in common. And there are things that you would expect: hospital-acquired infections, sepsis, medication errors, and also care team issues, right? So we developed this team engagement that's free access. So if you go to the website of GNSH.org, you'll be able to get to that website and work with these cases.
This is a 30-minute weekly
they're
initiative,
intended
right?
to be 30
Part of
minutes.
that.
And the way we got to 30 minutes, which is really unique, is we actually invited our industry partners in the hospital healthcare system. And we said, what would work? What could you allow your employees to engage in? And they said 30 minutes. That's what we could afford.
Right.
In terms of doing that, they
Sure.
could work on.
Let's start
So
there then.
That's where we said, okay, then that's what we need to do.
Right.
And so we've created these amazing things that are ways for us to engage around real patient stories that have often had tragic endings.
Okay.
And how can we examine them
Mhm.
and look at how we don't do the same thing ourselves within our system?
Right.
How do we learn from others and examine what got us to that point and avoid it?
Right.
And then have the team themselves engage in that and actually talk about it. And oftentimes teams will say, well, you know, that may be that story, but in reality, that happened here last week.
Uh-huh.
And how can we improve our own communication and collaboration and teamwork
Right.
to improve our own systems?
Right.
And looking at it from a system point of view instead of just one patient, one team, those kind of things. So this
Right.
has been, we are so much better together than we
Yes.
could be apart.
Right.
And so now we're exploring avenues of world organizations that are focused on healthcare worldwide,
Okay.
healthcare in, globally,
Right.
so that we can maybe make a difference with simulation in all of its facets, in creating ways that we can bring teams together with the focus in improving the care of the patient in front of us.
Right.
And so it's a privilege to be a part of this organization, really interested in others becoming a part of the organization because we need work and to be done and to envision and to operationalize the work that we're thinking about.
Absolutely.
It's just a lot of thought leaders who have come together really looking beyond any one organization, but collectively, what might we be able to do?
Absolutely. And creating resources that help anyone within the community. And so certainly, you know, I think if groups have an interest in supporting this kind of discussion of bringing together the community at a global scale and creating resources for the community at a global scale, certainly reach out via gnsh.org. That makes a lot of sense to me why INACSL continues to support this initiative year after year, because it's about, you know, contributing to the larger conversation for the industry as a whole. And that's what we really need to do, folks. Why? Because if we look at aviation versus healthcare, right, as an example and as a model, we're probably 50 years behind them with regards to the integration of crew resource management, team-based communication protocols that are absolutely required, simulation training and education and training recertification, and black box technology to learn what went wrong, right? And we don't have any of those things as a regulated, mandated requirement in healthcare. And so I think it's going to take, you know, coming together of all these different subgroups to start to build the messaging to convey the importance and the benefits of simulation across the world. So thank you so much for the work that you're doing and for joining us here today.
Thank you,
Thank
Lance,
you.
for the opportunity.
Cheers.
So.